We will call the meeting to order for Wicomico County Council Budget Recap Session for Tuesday, May 24th, 2022. We stand for the Pledge of Allegiance, if we could, please. Hang on one second. Start over.
To the flag of the United States of America and to the republic from which it stands, one nation, under God, indivisible, with liberty and justice for all.
Deeply engrossed in the paper.
Good morning.
Good morning.
If I may,
Certainly.
so Friday morning, I had a meeting with Dr. Mike Stoffer and Jesse Reed from the Board of Education. And they were coming to me that basically the maintenance of effort number that we have in our budget is higher than what ultimately got approved.
Say the maintenance of effort, so for the public, you're talking about the Board of Education's
Yep.
total operating budget.
The number that we supply to them, so we have in our budget $50 million.
Mm-hmm.
And basically, when we saw that number from the state, we were surprised by it. We were expecting the number to be more in the $49 million range, but that was the number that was sent to them by the, MSDE. MSDE was having a discussion, possibly heated, between them and the Department of Legislative Services. Legislative Services said MSDE was calculating the number inappropriately. MSDE was saying, no, this is how it has to be done, and this is going to be the number. Well, the very last day on legislative session, Department of Legislative Service got a bill passed that lowered the maintenance of effort. And then there was still arguing back and forth between the two entities. Ultimately, MSDE has acquiesced and the bill has passed and it has been signed, and we now have a lower maintenance of effort number that we could put in our budget by over $1 million, $1,012,000. 21,000, sorry, I reversed the numbers. So there are three options that we can do as a county. Option one, we can leave it in there. We can leave our number that we're funding them at $50 million. The downfall to that is that that becomes our run rate going forward. And if they have a decrease in, or a continued decrease in student population, and the calculation says the number needs to be lower than $50 million, we still would have to put in $50 million. Option two.
Let me ask you a question before you go further. How does that affect their budget? Because their budget is contingent on what we offered them.
In discussions with them, they have prepared two versions of their budget, one with 50 million and one with 49.
Okay.
I did discuss with Jesse yesterday. They do not have to really cut anything if they go down to the 49. They have some additional revenue coming from the state that they weren't expecting. So we can reduce them to $49 million, and their budget is okay. And they pass their budget after we pass our budget. Their budget session, I think, is the 14th of June.
Pass our budget?
What?
We didn't pass our budget.
Well, they will ultimately pass their budget. Their date for adoption of their budget, I believe, is June 14th, and we're looking at hopefully June 7th. So that's option two, is we can just cut them $1 million. Option three is we can remove the $1 million from the number that we send to them, and we can keep the $1 million in our budget and do several different things with it. We could work with the Board of Education to find one-time items, technology, security, that kind of stuff, that the county would then be the entity to purchase, and we would donate it to the Board of Education. We could also use the $1 million to bond less for the Mardella Middle and High School project that we have on the books. So there's kind of three options. Option one, leave it as is. Option two, cut $1 million. And option three is the hybrid. We leave the full $50 million in our budget, but only $49 million of it would go to the Board of Education, and we would utilize the $1 million in another format.
Well, we did the one-time funding before, and that helped out with laptop computers.
Now, this would be different. Because we missed the deadline for the one-time funding process with the state, that one-time funding is you're allowed to sign kind of a form and say, hey, we're going to give them extra dollars, and they make the purchases. Because we missed that deadline, if we're going to do one-time funding to help them, we have to, as the county, do the purchases and give them the product.
Allowed to do that?
We could do that, yes. We could donate those products to them.
Just for clarification, we didn't miss the deadline, it had expired.
In March, you have.
Yes.
Yeah.
I mean, we didn't anticipate
We
needing.
didn't know it was going to happen, so.
Correct.
yeah.
We didn't anticipate that we were going to need this part of the legislation, so we didn't file for anything.
That's much better terminology.
Sorry.
Well, you know,
Expired.
just saying, hey, we got $1 million here to buy whatever you want to buy, kind of gives a government, that government thing that, okay.
And
got
so
this
we
money.
can put restrictions. I'm sorry, I'm
Yeah.
interrupting you.
No, it's all right. You're right. I like the idea of us bonding less on Mardella. I really like that idea. You agreeing with me?
Absolutely.
God, I can't believe it.
Yeah, I wouldn't know where-
No, just kidding.
That
But
way
anyway,
it's committed.
it would lower our bond,
So yes, it would lower the amount that we would go to the bond market for Mardella by $1 million. It's actually $1,021,958 is what we would lower our amount that we would bond Mardella by.
And they're okay with that?
Yes. They came to us. They are comfortable with any of the three options. Do they like the idea of getting $50 million? Sure. Do they like the idea of getting $49 million and us working to buy other things? Sure. But they also understand our budget issues and the ability to possibly buy down debt for Mardella.
Well, I think if you, or we, anyone sitting here watches the news and sees where our economy possibly could be heading, it would be a good move to try to lower our bond debt as much as we could.
So the budget amendment would be, we would reduce the line for the Board of Education maintenance of effort line, and we would move $1 million into the line that's in Department 46, which is transfers to capital projects. Because those two then would offset each other. That transfer to capital project, we would transfer it to the Mardella. We'd also have to amend the capital budget tab and the CIP, because again, we weren't anticipating spending PAYGO funding for that project, but at least those would be the pieces that would need to be amended.
And we can earmark that $1 million for a project such as Mardella.
Just like we earmark all of our other PAYGO, yes, we can earmark it for, because by amending the capital budget, tab in the budget, and amending the CIP, that is prescribing where the money would be spent.
I think it makes a lot of sense, and actually, we seem to have agreement, council, executive, et cetera, to do that, so.
Yeah, there's a good possibility that later on down the road, we might have to take that money and put it back into Mardella, but the cost of construction, stuff is rising once they get down the road.
I look at how we got into this situation with the school system losing so many students is why the maintenance effort dropped. So that means that families had to pay for their children to go to private daycares and schools. And so that's why we have this additional money, because the enrollment dropped.
Homeschooling.
Or homeschooling. And so
That's a decision people make.
No, it was because of COVID, and they couldn't send their kids to school, and they had to work. I mean, that wasn't a decision. That was
That's a decision that people make.
to go to work or to take care of your kids.
Right. That's a decision, as you just said.
Schools are free
This or
and
this,
appropriate.
That's a decision, that's a definition.
It's a
Decision.
federal law for every child to have a free and appropriate education.
And
so when you can't go to
They had
work-
to do it
Hold on,
online.
Bill. Hold on.
Yeah.
Let her
Well,
finish. Just let her.
Look, can I finish, please? Can I finish my sentence? So that was, I mean, I just see, this is how we got into this situation, and schools are still closed one day a week or half a day on Wednesdays. I mean, what do people, 1 minute, please, can I finish?
Let her answer the question.
What are people doing for daycare? Because they're still paying taxes, so what are they, I'm just, I'm trying to, how did we get into this situation?
Comment, Bill?
Yeah, well, I guess one word, COVID. I mean, everybody's in this situation. I mean, this is not unique to Wicomico or any county or state across the entire country. This is just it's part of the process of dealing with COVID.
Well, and we don't have charter schools here. Other counties do.
Pam, didn't you say that 2 departments were arguing about what the money should have been?
At the state level, yes.
Did it say anything about the
So they
number
were
of students?
They were arguing as to how the calculation was derived. MSDE was saying that there was 2 kind of escalators or kickers to the number, while the Department of Legislative Services was saying, no, there's only 1. And MSDE was saying, absolutely not, or there's these 2. And so legislation, House Bill 1450 was amended, which is, I don't know which bill that one is, but it is amended, and it specifically spells out the lower number for us for Wicomico County's maintenance of effort, and it was passed.
They didn't say nothing about the decrease in the number of students in Wicomico County, did it?
Maintenance of effort is determined by student enrollment, correct?
But what they did.
Is that correct?
It is
correct,
one
but
of
what-
the
Okay, thank you.
calculators.
Okay.
But what is their calculator? They didn't say anything about the lower enrollment of schools.
All they said was that there was this argument as to how the formula was derived. And I didn't listen into the calls, I wasn't part of those calls, but the formula was different. The 2 state bodies were viewing the legislation differently, and ultimately it came down to our number is now $1 million lower.
Pam, is there a 4th option to that money? And I'm asking, you know, we seen county roads come to us the other day for this $400,000. I was at Hebron Saturday night, and I had a question from one of the fire departments. They were talking about the price of gasoline. Okay, the increase that they're having to pay, which we all are. You're probably going to see the sheriff's department and other departments, might even see roads come to us because of the price of gasoline and the operation. Can we move that money into contingency?
Yes. Ultimately, yes. We could leave the $1 million, but then that means, just so you're aware, when we go to the bond market, we will bond for the higher number.
Right, I understand that.
So-
So we got the bond mark, either lower the bond, move it to contingency, or give it to, you didn't give that option of the contingency.
But that is an option,
Yeah,
yes.
okay. I'm just sitting here remembering 2006 and 7 and 8. John, you were here. You know, Bill was here for part of it. And I remember the hand wringing that went on.
I mean, it
You
is,
know,
it is an option, and it is a budget amendment like any other budget amendment, but it saves us from going into fund balance if we need additional money to fund those other departments. And it just, it would leave our debt service at the number that we anticipated it at, and we would just have that additional $1 million for what this next year could potentially bring.
Yeah, but I like the idea that there's four options, but reducing our debt, going for $1 million less, that's a lot.
That's a lot.
And that's for, I
20 years.
What impact would that have on our
20-year notes.
yearly? payment. You don't know that answer, do you?
Not off the top of my head, I apologize.
I didn't think you would.
But to that point, that's a compounded number.
Correct.
So you're not saving $1 million, you're saving $1 million plus.
Plus the interest.
Interest
yeah.
over 20
That's correct.
years.
I understand. I was just looking at the two options, Bill. You
Yeah.
know,
No, it's a good point.
And in fiscal 23, it does not have a significant impact on the debt service number because we always anticipate that we're closing basically at a point in time where we would only pay a small amount of interest in the fiscal year that we close. Where it does save us is in the future years, in the 24 and out.
And we
Are we
have-
going to be sitting here a year or two from now saying, well, we saved this $1 million one time from the misrepresentation of the maintenance of effort, so we can do this? I'm just,
I wish I had that crystal ball. I don't.
But we have a healthy fund balance.
We do have a healthy fund balance, and that's part of the reason why we've kind of crafted the budget the way that we have, is that we have that healthy fund balance to hopefully see us over any hurdles that we have.
But we also have a real low interest rate, which everybody says that's why we should borrow money right now, too, right?
Not anymore.
This is-
Well, but,
I understand.
so I can't, as you see, the Fed has already indicated that they're going to raise at least 2 more times, possibly 3 more times this fiscal year. The timeline that we're looking at to go to the bond market would be October. I can't predict. I expect it to be higher than what we got. I don't expect it to be as high as some of our historical numbers, but I do expect it to be higher than what we got.
Is there could we use that money to pay off any higher interest bonds that we have?
We always look at that. So there are very specific requirements as to when we can refund bonds, and that's what Davenport helps us do every year. So in the 2 years that I've been involved with doing debt with Davenport, they have looked at the effective interest rate that we're paying and the effective interest rate that we could probably get, and looked at which ones are eligible for refunding, because you have to hold some of your debt for a period of time before you're allowed to refund it. So in the first year when we did that bond, we also did some refunding bonds that first year in that January timeframe. I want to say it was January of, I'm losing track of time, I think January 21. We did a couple refundings, but there were a couple refundings that didn't make fiscal sense, so we did not pull the trigger on those. Then the ones that were eligible when we went this past December, we did pull the trigger because those, the refunding was financially advantageous to us.
John, why don't we take a poll and see where we're at as far as what we want to do? So, and then we can argue more if we want to. Or discuss, not argue.
I was going to just jump into that. I haven't spoke yet.
See, Josh hadn't said a word yet.
I was wondering what was going on there. I kept looking at
I was going to
about
wait till y'all.
Mardella.
I know. First of all, the $50 million. If we keep, what is that extra? If we did go with option 1, that extra $1 million, if we left that in, what does that go towards?
It goes to a broad host of their budget. I don't have.
If we drop it down to 49, or then MOE is, or maintenance service is going to stay at 49 million going forward, right?
So our run rate, our baseline would then always be the 49. Now, we're not allowed by law to go lower than 49. So even if the enrollment next year indicates a number that's lower than 49 million, we will not be allowed to go below that, but we're not allowed to go below that this year either.
Are we still the second lowest locally funded per capita county in the state when it comes to the amount of money that we put towards our kids?
I can tell, I don't have an answer.
I think Caroline County has been the worst in the state. I think we are still number 2.
Are we still the second highest state funded? Because I know we compensated through that.
I'm looking at what, so Allegheny County, just based on what this legislation says, Allegheny County is required to put in $31 million. Caroline County is required to put in $16 million. Dorchester 20, Garrett 28, Kent 18, and this is a population-based number. Somerset 10, and then Talbot 43. If they fund beyond that, I can't answer that question based on the information that I have. I just know that those are the numbers that the state is mandating that they each have to spend.
Well, I bring that up because I think that, as you all have heard me say many times before, I think the one concern that I think we should all be making sure is on the forefront of our minds is that going forward, we may not have the disparity grant money. I do not the slightest bit feel confident. That's between 7 to 9% of our budget, give or take. What is it, 7% this year? This is already, this calculation outside of disparity grant already has us, a lot of state investment into our schools. Because we are generally a poor county or one that's highly disadvantaged in other ways, we get a lot of support from the state. But let's say that rug is pulled out. Let's say next year there's a new appropriations chair. There actually is a new appropriations chair next year.
It is.
Yeah, so when that's gone, let's say they suddenly figure out, hey, you know what? I don't believe in the Norm Conway one Maryland funding strategy that the state has had for a long time. So if we lose that amount of money, we have to suddenly then in the future come up with a whole lot of money that we didn't have to plan to come up with, because for me
I'm sorry, I'm
sure.
interrupting you.
No, I'll be quick. I'll say, for me, that is a bigger concern. Now, I trust your skills and understanding way better than I.
So one of the things is the maintenance of effort. If we don't meet maintenance of effort, we don't get our disparity grant. If there's no disparity grant, does that change the total course of what we have to do?
But I don't think anyone's suggesting that we not meet maintenance of effort.
Well, but that's what I'm
Sure.
saying. But you're concerned that disparity grants could go away. That then kind of opens the book for a lot of things.
A lot of different.
Because we meet maintenance of effort to ensure we get our disparity grant.
Sure.
So,
Last thing I'll say, Mr. President, I think in general, I do think that the fund should stay. Let me back up. This is certainly a great time to borrow. The funds that there's not a better borrowing, that has been a great time to borrow. Obviously, it's going to be harder and harder to borrow. It's going to be more, so I don't think we're going to, the current debt that we have it's actually a lot of good positive debt in there that's going to get worse. So I think in general, however we go forward, I personally would love to see it stay in option one, where we continue to invest, and that way we're preparing ourselves in the future for when we will lose the money that the state chooses to give to us. We will be better prepared then to locally pay for that. But I will say, I think in general, I think the fund should stay within education, no matter what we do.
If we put it in, well, the first thing, if we raise the bar by leaving it in, that's what we're doing. We're raising the maintenance effort bar, right?
Yeah.
So the next year. Okay, the danger of that is if we do go into a recession like being predicted, I remember at one time we actually got a waiver for the maintenance of effort, correct? Yeah, at one time. But that might not happen again. If we put it in contingency, it could be transferred to the board, correct? Or
it could be transferred to any department.
Any department. If the need happened. That's another option, put it in contingency. Lowering the debt is a great idea, I think. So I'm good with either one of those two.
If we leave it at number one, where it's 50 million, we'll be obligated for that 50 million next year too. We will automatically raise
The bar,
Yes.
you're
our
raising the
maintenance
bar, yeah.
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 Hey, question I have. You're talking about using the $1 million to pay down the bond, but I thought we already bonded this.
So Mardello, you have to bond multiple years to get that project accomplished. So,
The bonding last year didn't do the total project.
no,
Right, not done
no,
yet.
no.
That's 72 million, I think it is, isn't it?
So,
Yeah.
we are looking at borrowing
School is 72, and I think we're
$10.1 million in this fiscal year for,
8.720 next year. But sometimes I get very confused as to how much we commit when we bonded the total 50. I just don't remember exactly
So-
how it was portioned out.
yeah, so there was money in there for Mardella, but Mardella is spread over multiple years. So in fiscal '23, we're looking at borrowing basically $10.1 million for the Mardella school. What we would do then is say that we're only going to borrow $9 million and change.
So my question is, since we're borrowing 10 million, is there another bond we're expecting the year after that?
Yes.
Well, then I would think that we definitely would want to keep the note, this coming note, and not cut it down by $1 million, because I don't think it's going to get any cheaper the year after. I think it's only going to get higher.
Again, you're saving the concept of the principal or the interest portion.
Which is a huge amount.
Right.
Especially on $1 million note. So honestly, I think that it would be a little foolish on our part to apply that $1 million to the bond and to reduce the bond by $1 million now, because in 2024's CIP, or even 5, I'll repeat myself, I think the interest rates are only going to be higher.
John, what is your opinion?
That it goes toward the first one that I agree with you with,
The bond, lowering the bond?
lowering the P&I for the board, for the Mardella.
Okay.
And just for an example, on we work with Davenport to every year when we do bond to see if there's something that we can do on our taxable bonds to reduce our to lower those bonds that are out there. When we just went to the bond market, we got 16 million at 1.8%, which saved us about $1 million out of the last bond market.
Well, again, Josh hit on the highway user, on the disparity grant. I think a much better use of it might be to reduce our pay-go that we have in the budget as a whole, and to protect our reserves in anticipation of coming through some very hard times in the next 3 or 4 years. And
You're talking about putting in reserves.
put in reserves
I'm good with that, too.
by using that $1 million to apply it towards pay-go. Others put it in reserves so that we're protecting that. You follow me? I'm saying instead of the bond, put it in reserves.
Well, if you there are 2 line items you could put it in. You could put it in the, it looks kind of funky because of the fact that on the revenue side of the balance sheet, we're saying we're using fund balance. But if you want this $1 million because you can't kind of alter revenue, I'd have to say we're putting it in fund balance, and the two would net each other. Or you could put the $1 million in contingency, and if it's not used, because it is locked, contingency is locked without coming before you guys it drops to the bottom line. It will roll into fund balance. The advantage to having it in contingency is that we then also don't have to take it out of fund balance, put it in fund balance and take it back out again.
I guess, do you have two things here that come to mind. As I said earlier, we have a healthy fund balance. It's not like,
currently.
not only do we have a healthy fund balance, my understanding is per capita, we have the highest fund balance in the state of Maryland
I believe it
by a lot.
yeah. And we're looking to adjust that as well.
And that's
Right.
part of the strategy we had in here is we are trying to utilize fund balance. Again,
I'm not done, but my point, my other half of this is, getting to John's comment, which sort of makes sense, except for we have like I said, we have a healthy balance, so we don't need to add to that. The other thing is that, we could still, if we want to put an extra $1 million toward Mardell out of our balance next year, we can do that. We don't need to put this in there. We have, what is it, 30, I don't even know what it is, that number.
How much is in the contingency?
Yeah, it's a big number.
our contingency number is, give me 1 second. I want to say there's about $1 million in contingency in the budget, but let me, before I
I
say
think
that.
Larry's asking about in our.
Yeah,
So you're
balance.
talking about the fund balance. I think, I want to say, was it $52 million?
Right, it's like 52, yeah.
How
right.
much?
$52 million in unreserved fund balance.
So
So
That's what I'm
this
saying.
would turn it to 53, 112,000.
Well, you have to take into account the fact that in 20, so that's 21's end of the year number. There's the anticipation that we're going to spend some in 22, and then we've budgeted to spend some in 23.
But to my point, if
Yes.
we want to put an extra million toward capital in '24, we got 52 million, 52, 53, we got, it's better to spend it in the year we're dealing with, because that's the other thing. I hate to say no one's going to remember this when we're sitting here doing budget next year, but no one's going to remember this when we're doing budget next year. But I just think it's better to deal with in the year that we're dealing with it, like putting it in toward, let's say, Mardella this year. If we want to put another million toward it next year, we've got it if we want to do it. If interest rates are going sky high and we want to borrow less, we
I
can use
would-
our fund balance.
Yeah. The recommendation from administration is that we would do less debt.
I'm sorry. I hate to keep beating a dead horse. But, John, you were here. Bill, you may have been here for part of it because both of you took a year off, I think. But I remember the hand-wringing, the rifting of employees. People were, it was... I remember running into Phil Tillman one day, and I said, Phil, did you ever go through anything like this when you were on the council? He said, no, we always had a little more money each year, and we made out all right. And, it's just because we got it doesn't mean we have to spend it. Setting it aside, we just had county roads come in and want $400,000 just from an increase in one product that they use, just one product. That's blacktop. I believe in a strong reserve and a strong contingency. I really do. Because
We got the biggest.
well, I know, but how big is it? Is it big enough? We never know. And John said apparently you all got plans to try to reduce that. So just because we have it, like I said, doesn't mean we have to spend it.
And I think,
And John, both Johns, kind of agree that we shouldn't spend it. I think we shouldn't spend it. Either reduce the bonding or put it in reserves, contingency.
Can I make a suggestion? Sure. Joe, as you said earlier, can we go around, get a poll on, I don't know, since it's a work session, I don't know if we do actually quote motions or whatever.
we can do it. We always do a consensus.
I'd make, I'd like to see the poll on option 3 that, we take that $1 million and put it toward Mardella, as was suggested.
Well, we have two questions on the table, and this is what we'll decide on, I think is what you're getting at, Bill. We're either going to take the $1 million and we're going to reduce the future bond by $1 million, or we're going to take that $1 million and put it in reserves. Is that correct?
It is semantics, but it is a difference.
I said reserves.
Reserves or contingency.
Contingency. All right, contingency. Forget that.
So-
Contingency or put the $1 million to reducing the bond.
Contingency is cleaner because then it would drop to the bottom line if we aren't going to use it.
So when we take a straw poll, we're going to say whether we want it contingency or reduce the bond.
Correct.
Okay? Larry?
I don't mind putting it in contingency if there was some way we could earmark it to go back to Mardella. Otherwise, I like the idea of reducing the bond for Mardella.
So which one's it gonna be?
Make it clean.
Mardella.
You want to put it in contingency, or do you want to reduce the bond?
Reduce the bond for Mardella.
Joe?
I'll vote to or reduce the bond. However, if it comes up on the other side where people want to do the contingency, I'll do that. But right now, I'll do it to reduce the bond.
Contingency.
Nicole?
I would like to see it go back to the taxpayers, but I don't think anyone else agrees with that. So I would like for it to go into contingency.
Josh?
I'm for option 1, leaving it at 50 million. But that being said, I want the purpose to go towards education.
Which is the
Contingency or
bond.
bond?
I'm not quite
Bill,
sure.
let him vote.
That's what I'm saying.
Do you want to put it in contingency, or do you want to
Right.
Bond then.
bond? Bill?
Reduce the bond.
Okay, so we have 4 votes. I say contingency. I say contingency.
I can change mine and we'll
Yeah, why don't
mess it
you?
all up here.
I don't think it'd make a difference.
All right, so we are going to reduce the bond by $1 million.
Okay, so we will have for council when we go for the night of language to amend the budget by reducing it from the Board of Education and moving it to the transfers to capital projects, also amending the capital budget and also amending the CIP.
We have to have a public hearing to amend the CIP, so we'll have to schedule that
Okay.
for June 7th.
Okay.
So you're reducing the current CIP,
We're amending the current
amending
CIP.
the current CIP.
Yes. Amending the 23 CIP,
It's 23 through
27
27. Yeah.
CIP. Okay, so,
That only took 40 minutes.
but I figured I needed to get that out on the table.
But it's a good 40 minutes.
Additionally, I'm aware of the change that we suggested for the airport related to the fact that they had the overstatement of their number, and that we would be, as the administration, proposing making that change, since it does have an effect on revenue. But council had agreed that that one would move forward as well. So that would be in your motions for the June 7th meeting. After that, so on the June 7th meeting, we are coming to you for a fiscal '22 budget amendment for adding 2 additional license commissioners for the Liquor Control Board. I was not aware, and that number had been raised to I think 5 members. We only had 3.
That was an agreement made
Yeah.
with the state.
Yeah.
Yeah.
So those members have finally been appointed and approved by the governor, and I didn't know about the legislation. I apologize. So we're asking for the '22 budget to be amended, and we'll have to amend the '23 budget to include those 2 additional commissioners so that we can pay them next year. It's basically $8,000 in salary for the year between the 2 and a little bit in FICA.
Where are you going to be taking that money from?
So
Agency.
I can do it one of 2 ways. I can propose it from our side, and we would just raise the amount that we would utilize from fund balance. Or I could, for $8,000, balance it off this $1 million number that I just,
Why don't we wait until we get done with whatever else we're doing and figure out what you're going to have left over?
okay.
Yes.
That was the list that I had.
Okay, council members.
Do you have any changes to the, from the executive side to the salary increases?
I mean, the classification and pay plan?
Yeah, classification and pay plan.
Not in changing the dollars. I have language potential changes to how we possibly view some of the spreadsheets, but I do not have any dollar changes.
So there's no dollar changes from,
No.
Now, we received an excellent email way over my head. I think we forwarded to you in reference to an individual who had suggested that a lot of the positions were inconsistent, and I'm hoping that we have managed to rework the position titles, et cetera.
We are looking at the position titles to make sure that consistency on the title side is there, but we are not suggesting any changes in dollars.
But you are changing the positions.
We are looking at them. I will have all of that for you on the 7th.
Okay,
well, you want me?
sure.
You know, we've received a lot of, I don't know if some of the other council people have or not, but about the large increases, several large increases for just a few of the employees. So my suggestion through this, or thoughts through this, is, and I asked Laura to go through them and earmark the ones that were getting the largest increases, is that to make it, instead of picking one or two out, is to cap any of the pay increases at $20,000.
Ultimately,
Then you'll have your money for your liquor board members. Yeah.
it is council's prerogative to suggest changes. We have presented what we think are the appropriate numbers.
Sure. Sure.
How does council feel about that?
Comments?
Yeah, I support what was just said. I mean, I just want to follow the study.
Yeah, I like to be kosher and all that, so, if the study had said 20,000 lower to where this, then I would have gone with that, but I'd say whatever the study says. Let's roll with
Yes.
that.
I mean, clearly the acting county executive and HR clearly come through this very well. This is what they're recommending.
You don't want to cap it at 20?
I mean, our acting county executive this is what he feels is appropriate. And he oversees these departments.
I mean, you got somebody getting a $33,000 pay increase.
It's the position that's getting the increase.
Pardon me?
It's the position that's getting the increase.
Well, I know, but the person that's working there is getting it.
I think sometimes that you can't overlook the reality. I understand the data, 100%, I get it. But I don't think you can overlook the reality that giving a position a $30,000 raise does give an individual a $30,000 raise. And I think that is something that, warranted or not, we need to evaluate that from a management perspective. What is that like? What is that for you to give someone a 30% increase and almost, a 40% increase in their salary, over a 40% increase in their salary in 1 year? Is that really good management? The other side of that is, what do the other employees think? And I know the other employees aren't really happy with that. And I believe our employees recognize the intent as well. But I still think the reality is, I agree with what Joe says. I think the reality is we should try to be a little more empathetic as far as what we are attempting to do. And I think a $20,000 cap is appropriate. I don't care who you are. If I got a $20,000 increase, I'd be tickled to death. I wouldn't go back and say, well, the data said 30. I could get it. And then, if you want to do 10,000 more than next year, work it in. But I just think, as far as right now is concerned, that's rather extreme to go as high as some of these are. I think the 20 is a good level compromise as to, as far as I would like to see it go as well. So that's my position. So,
Wasn't there some
and these are all great employees. Trust me. I think they're all great employees. There's no reflection on the employees whatsoever.
Wasn't there some changes on your side about what the plan wanted to do?
So there is a spreadsheet in your budget of additional new positions.
Is that executive exhibit E?
Is that the one that's titled changes?
Yeah.
So primarily, yes.
Yeah.
So that is, but as we have done in years past, you have a position control document. The position control document that we have placed in here is based on where people would be today if we were operating under that under the new plan. What E is doing is looking at specific positions based on either new positions that haven't been considered before. So the evidence techs at the state's attorney is not a title that we currently have. And so we're asking for that title to be added and the ability to hire for evidence techs in state's attorney. And so we would be adding that to our position control listing for the next fiscal year. Additionally, there are some other ones that primarily through discussion with the state's attorney's office and the circuit court, with the judiciary head that they were looking for additional funding for a couple positions.
So in reality, you're not sticking with the exact plan that Bolton did either.
On the departments that we have control over,
Yeah, but
we are. We
But-
have been requested by the state's attorney, who is an
Oh, I
elected
understand.
official.
I know.
And we've been requested by the head judge.
yeah, I understand
make
that.
changes,
I understand
and-
that, but you're not sticking exactly with this, the exhibit that Bolton did. You're changing something, right?
We made our recommendations.
Yeah,
and
yeah.
we'd like-
So you-
we'd
you've
like
changed
for them to
something.
be-
Okay, all right.
We'd like for them to be put forth
Yeah, so-
as we recommend.
Well, I guess we need a poll on that one, John.
I think the council has received the position control document Exhibit F, which Mrs. Hurley put together for us. And in that's where you see these proposed cuts. Now, we have three ways to go. We leave it where it is. Councilman Holloway has recommended a maximum 20,000 cap in increases. Or if anyone wants to maybe get into any itemization, that's option number 3, which I would rather not do. So, where would, I'd like to, we'll take a poll as to where the council is on this. Councilwoman Ackley?
So I respect what you have to say, Mr. Pizzotta, and that you manage these employees, and you have the best assessment, but I think the 20,000 cap is reasonable. It's meet in the middle, and I think that's fair.
Josh?
I'm good with administration's viewpoint.
Bill?
Option one,
Administration?
yes.
Larry?
Going to go with the 20 cap.
Joe?
I'll go with the 20 cap.
Ernie?
Administration.
And the chair will go with the cap. So we have a 4-3 straw poll on cap.
So, just so you're aware, one of those positions splits funds. And it, it makes it such that it's $451, but it's $451 and it splits funds. And the only way to actually reduce the salary number without amending the revenue number is that we would amend the position control document to say this is the max that this position is allowed to have. I would not actually amend the budget numbers because I can't amend the revenue side of things to make everything balance out. But based on legislation with council, we can't pay more than what is in the position control document. So the $451 would just drop to the bottom line at the end of the year. So I just wanted you to be aware you will not see a budget amendment for that dollar amount because I can't make it work with the restrictions that are on amending the budget.
You lost me.
And just for
I don't
clarification,
know what
it's,
that means.
it's because it's an enterprise account.
Oh, okay.
And because, they have the revenue and the expenses together in that enterprise account. That's why she's recommending that we just make that change to the position control document. But I believe it's also for the Public Works Director position.
It will be that one as well. But again, if you amend the position control document in here and we don't amend, and you don't see an amendment to amend the actual budget, just be aware that we will not pay more than what's in the position control. So if the number if there's savings in the line item, that those savings drop to the bottom line at the end of the fiscal year.
If you adjust the cap, we wouldn't be able to give it to them the next year without without amending that. Again, you're saying to change the range, to reduce the
No.
top
I'm just
range?
saying change the document. So you've listed 6 titles that are over $20,000. We would change those numbers in the position control. And for 2 of those titles, I can't actually amend the dollar amount of the budget because it also amends revenue.
Okay. All right, thank you for that.
Before we move on, because
Yes.
I'm going to get questions on this.
Okay.
On the $20,000 cap, how did we pick 20,000? Why not 25 or 15? Where did 20,000 come from?
well, I picked 15 to begin with. You've got to look, I think that was just a number, John, and I know that's not a good answer. But you've got to look, if you look through the whole aspect of it. Now, I did a little follow-up on my own on a couple of these positions in the private sector, and I guess that's kind of where I came up with that number. But, like I thought 15 at first, and I said, we have to hire people, I understand that. But the first thing I looked at was morale. And I started having people walk up to me with this piece of paper saying, what is this? I'm getting $700 in this one position, and I'm going to say position now, is getting $33,000. You're looking at a real morale problem there. So anyway, I guess that's the best answer I can give you. It's an arbitrary number.
Well, but also realize it's just as unfair capping it at 20. I mean, percent-wise, you just created this very unfair now percent increase. Because that's a raw number. Some of these positions are, the current salary's 50-something, some of them are 90-something. So when you cap it at 20, the 50-something.
It does alter the position, the maximum, but we'll work with it.
Yeah, you talk about.
Management does take very seriously the employees' morale and the employees, what the intention of this salary study implementation is.
If you talk about percent, Bill,
It's just math.
I guess my thoughts are we could just raised everybody's salary in the county percentage-wise and done without a study. We could have done that. That would have seemed to me to make a little more sense, and we'd save money on a study, and everybody would have got a raise, and everybody would have been happy. So anyway, in this study, there's a lot of unhappy people.
There is.
A lot of unhappy.
We're still giving, in some of these cases, we're still giving a 30% increase, Bill. I don't think that would be justifiable to say 30% across the board for everyone.
I didn't say it. You didn't hear me say that.
Well, you said that you thought we should work on a percentage basis as
I
opposed to a
didn't
flat.
say that either.
No, I said that, kind of.
No. What did you say?
I said math, 20%,
Not a problem.
20,000 on 50-some thousand and 20,000 on 90-some
The
thousand
20,000
is
put somebody below.
totally different percentages in terms of the increase. That's math, that's a fact.
Right, but if you're suggesting that
They
we
already
go,
changed, they already made the amendment to lower.
That new range is 93.
Yeah, I think is what are you getting at what I'm thinking is the
You've lowered the range.
issue? Or we now have a problem?
I believe you now have a problem.
Yeah.
So, and I was also looking.
Never mind, it's 86.
Yeah, because I checked that, and I thought
Okay.
it was.
Will that
Okay.
affect
They're
the
all
Public
within the
Works
range.
Director?
Pardon
Because the
me?
Public Works Director is now going to be, what is it? It was suggested 134,
Well-
131, now it's down to 114. Is that going to affect
So,
the range?
so here's the other thing. is that
Absolutely. As well as the Assistant Director of Administration, as well as Director of Administration.
So
I beg
there
your
are
pardon?
6 employees.
Sorry?
There are 6 employees currently that are currently hired that are getting more than 20 based on the original plan. Your amendment would take them down to 20. I think they all fit in the range. There are additional positions that are budgeted for more than 20 because they're vacant positions and we budgeted it at the midpoint. Are you expecting those to be brought down by 20, or can we leave those budgeted at the midpoint to allow the ability to hire for those positions? Director of Public Works as an example.
first of all, everything that we've recommended as of right now is still within the appropriate ranges.
I believe so. I
I think it is. I think they are.
The only one I couldn't verify was the corrections departments, if you want to look at those, but I verified the others.
And so the second issue is on the vacant positions, whether we, since they are vacant positions, they are empty right now, whether we allow the recommendations from the executive to to stay at the rate as recommended by the executive branch. And we are talking about the executive administration, planning and zoning, and public works. Whether we want to, in other words, because it's not really giving anybody a raise, it's setting the new bar as to where the county needs to
Yes.
be in order to compete with other counties. So
I would be okay with that.
you'd be okay with that?
Yeah.
I would be okay with that.
I appreciate that consideration.
So the recommendation and the budget amendment that you would see would be for the current filled positions.
Well, as soon as we take a consensus on that, do we have a consensus that the vacant positions will remain where they are? Larry?
Yes.
Joe?
Yeah.
Ernie?
Yeah.
Of course, yes. And
Yeah.
Josh and Bill, and, yeah, okay, so we do have a,
Okay, so it's the current filled positions, and the vacant positions are allowed to be budgeted by the standard that we'd set, which was at the 50% mark, to allow us the ability to hire.
thank you for bringing that to our attention. Okay,
That only took 20 minutes.
we are moving right along. Any other questions that we'd like to see addressed?
Pam, will you be syncing the classification and pay plan with what's listed in the budget? So like the titles match and,
I'm going to attempt.
okay.
It is a lot. I will say it's an attempt.
Okay.
Getting back real quick to Board of Ed, so the maintenance of effort only went up 200,000, 250,000, right, this year?
So if we go from the, down to the 49, let me make,
Because you were increasing it by 1,282,000.
Yeah.
So if we're knocking off 1,020,000,
yes.
so it's, okay, all right. So that was just my inquiry. The
Just-
next, yes,
Just before you leave that topic, the FICA, the 7.65% will also come from benefits for each one of those reductions.
Yes, so I will have to, I'll modify all of those.
okay.
I have a budget question. Is there anything budgeted for this police accountability board? What are we hearing about that?
So,
Well,
the short answer is no, because we're still unsure as to what we will end up having to pay for, so we will have to come back to council.
A contingency.
Contingency fund balance, take your pick where it comes from, but we stated that when we submitted this to you, that it was too much of a dartboard, and it didn't make sense to just kind of throw the dart and figure out where it landed, was to actually kind of start moving into this and see where we're going to need to be.
I apologize. I do remember you saying that now. I just wondered if there'd been any updates.
No,
I guess
we
I
have
should-
not.
I just should have asked that instead. Okay.
No, we have not changed anything
Yeah.
related to that.
yeah, I had forgotten, so cross your fingers. I think the next item that the council was concerned about, which we had expressed, I think, in our last meeting, was our concern over the environmental health specialists, wanting to see a supplemental increase. I think what we'd like to do is try to see the funding there, and then let everybody else worry about the dynamics of how to make it happen. And, you have to get back to us in 6 months and let us know. Hopefully, it won't take that long, and hopefully we can implement it right away. But I know that when Ms. Brewster was here, we were asking her what the number might be for a supplemental increase, total balance for, I think, 11 and a half positions, and she had suggested the number was around 57,500. That being the case, to maybe make it a simple process, we could possibly take that from the community promotions amount that was recommended, which is also related to environmental health, which had been which had been recommendation as a $500,000 grant to help homeowners who have failing septic systems. So we're open for discussion on that.
I think that's an excellent idea. I mean, I think whenever I talked to Ms. Brewster, she said even in the Chesapeake Bay Restoration Fund, there's still $100,000 left that hasn't been applied for the end of the year. And yes, there are priority areas that come first, and then after that, other citizens can apply. And so if they can't get their permit for a septic, I don't know if funding septics are, that's not, it's kind of putting a Band-Aid on it. We're not really addressing the problem of not being able to get approvals for septics.
I don't know, as you somebody said, this came up before about us putting money toward positions at the health department. We had an email about that, which I thought said we couldn't do that.
So
I think it might have come from, did it come?
the difficulty with that is these are not our employees.
Right.
So we are now looking at paying somebody who is not our employee. We can't compel the state of Maryland to give them funding, additional funding. I will say I have a call in and they're looking at it. I found out Friday that supposedly Howard County does this. I have contacted Howard County to find out how they achieve it. They mentioned that she thinks they put them on payroll, which then kind of has a cascading effect, because then you have to worry about workers' comp if they get hurt, if you're putting them on your payroll, that kind of stuff. So,
And additionally, there's a myriad of issues on the permitting side and how long it takes. Staffing is one issue, but staffing is an issue across the state. So looking at increasing salaries where we made that push, 6 months ago when we co-joined a letter for the state to look at those salaries, and that was rejected. But there are several issues as to why permitting is not happening in a rapid fashion.
Well, and I get that too, but I'm listening to what the health director's trying to tell us. And when someone says that you're supposed to have 11 and a half positions, you're supposed to have 11 positions, you only have 1.5 positions, that's rather shocking. I think also it speaks for itself as to what is happening in Wicomico County. Nationally, the big issue right now nationally is the fact of baby formula. And everybody's saying, why didn't the federal government realize that there was going to be a shortage in baby formula? And now we're having them shipped over from Europe. Baby formula is coming in from Europe because no one thought ahead. I think we're almost in the same type of a critical situation here, and it's staring us right in the face. You have 1.5 individuals, and actually I don't even think it's really 1.5 as far as who's qualified to go out into the field and do what's necessary for septic issues, whether it's for a new home or whether it's for having to put in a new system in an old home. We don't have staff to go there, and we know that it's piling up months and months and months where someone calls in and said, I have a problem today, and you have to make an appointment. You're not going to get somebody out there next week. So we are at a critical juncture. I think we are threatening to put the industry to a complete standstill. As I stated 2 weeks ago, an individual I spoke to who lives in Delaware, has property in Wicomico County, said, it's dead in Wicomico County. I don't even want to think about walking into Wicomico County and starting to build a new single-family home because I know the timeline is going to be too long to get anything done.
It's just not,
Joe.
It's just not homes. Carl Smith, who's a volunteer fireman in Parsonsburg, came to me last week. He's been trying to build a pole barn. He has to have somebody from the health department go out and do a site, I don't know if you call it a study or whatever. He's got a septic, he's got a house, he wants to build a pole barn. But they have to come out and say, okay, here's your septic, here's your reserve area, and it's okay to put your pole barn here where you want to put it. He can't even get that done. He can't get somebody to stop by for 5 minutes. And I called, and I talked to the gentleman at the health department, and he said, Joe, I got a stack of papers 2 inches thick. I'm working through them as I go through them. He says, I'm not blaming them. I don't know where to lay the blame at, but there's a problem that we have to solve, and unfortunately, I think we have to solve it some kind of way. I don't know.
I just suggest that there's a lot of issues as to why the permitting is not happening in a rapid fashion in some cases. In that case, if you'll forward me that information, I'll try and get an answer as to
I've already
why.
talked to him. I mean, I don't have emails.
Okay.
It was a personal conversation. He came in the store, what I'm saying, and then I called the gentleman at the health department, and I'm not blaming the gentleman at the health department. He's working through his stack of papers. He's working, like he said, I got 1.5 people, and that's what he told me. So anyway,
Cool.
Just 2 quick things. One is there are several counties that do fund these positions through the health department. I can give you a list of
Can you
those
tell us
counties.
what they are?
Yeah, absolutely. I'll get you a list of them.
Okay.
The other thing is, Was there a need for funding of new septics? I mean, did the health department come to us and say, citizens can't pay for new septic systems? This is, I'm just wondering how that was determined.
So to your point on the bay restoration fee funding, typically the health department does run out of money at the end of the year. We have had occasions where citizens reach out to the county executive's office wanting assistance in either alternative methods or paying for their septic systems that have failed, their on-site disposal.
So there is a demand for that, of needing financial assistance for their septics.
There is a need, but it's also an effort to use the American Rescue Plan funding for its intended purpose as in infrastructure and septic and water and et cetera. So we're kind of earmarking for, the possibility that we have a sector in the county that has multiple on-site disposal systems. So we've got something to work with to help relieve the health department should they run out of funding.
Last night, I talked to a gentleman. He said Somerset County doesn't require people to have degrees to do perk tests. I haven't called Laura and talked to her about that. He said they just, in other words, the requirements aren't as great for the people doing that in Somerset County as they are in Wicomico.
What you're seeing here is that we're trying to get as creative as we can with the health department because it's at such a critical juncture. I mean, we've been battling this since 2006 on and off, and we recognize the fact that the state of Maryland came in here about 3 years ago and made things a little bit more onerous for us to work through the paperwork, because then we were looking back to files to 2012, trying to follow up on those issues, and still then trying to do our current business. Didn't help, John, and I recognize what you're saying, that there are other issues at hand. But right now, again, we're trying to get as creative as we can and trying to solve the problem as immediately as possible.
Understood. I'm just asking that we also consider unintended consequences, and that I appreciate the historical knowledge that you've been working with us for 2006, but looking at a snapshot as to what's going on now, I suggest there are, again, several issues as to why permitting is not being done in a timely fashion.
The one other thing is that the funding for the septic is coming from American Rescue. I'm not sure if we are looking to move that money over to the health department, it meets any of our definitions to be able to pay for it out of American Rescue.
Again, what we, as a council, if we choose to do this, if we come to that consensus, we can only recommend to you that we would like to see that amount, and it is always up to the administration to decide how you're going to make that happen.
Sorry
As
about
to
that.
what
Didn't mean
you
wake you up.
legally do.
If
But
I could make a suggestion, I mean, because we all know how big of an issue this is, but this particular, like what we're talking about here, this amount of money or whatever, I'd just rather see us just leave it alone, but still pursue this, what we're talking about. Because like you said, there's unforeseen issues, you bring on, or you start putting money, if that would help bring us people, but do we have to make them, right, whose employee are they? The whole complication of their state employees, we're putting money toward that. But what does that mean? There's just, seems like there's a lot more work here that needs to be done. That work can still be done, because you can still come back to us 6 months from now and say, look, here we got as part of our super implementation, here's a plan. We don't have that plan, it's being worked on in terms of, how to start implementing this, but we're just not there yet. So I just rather see us just leave it alone for now, but not leave the idea alone. Just leaving alone this in the budget for the moment. We can still move this around some if we have to.
To that point, Bill, is there any kind of qualification sheet that somebody has to fill out to show that they're qualified to get these funds to help put in a septic system? Who makes those decisions? In other words, who says, okay, this person can get the money and this person can't?
So ultimately, the criteria for that would come back before council to approve as to how we implement that plan. It would not just be somebody walks in the door and says, hey, I need this money. There's going to be specific criteria that just hasn't, until council and the budget is adopted, it didn't make sense to spend time crafting if there wasn't an appetite to create the product.
My biggest is like other people said, why give this money to people for septic systems when they can't get a permit to put one in? So I guess that's.
Put this in the '24 budget. Just-
It seems
joke.
like you said, it goes back to 2006, that Wicomico had a problem with septic systems and stuff with the department or whatever they were doing wrong, the state stepped in. It seemed like we need to get the state and the health department together to see what was the problem and what we need to do to correct the problem, because apparently it looked like the state is still putting serious recommendations on Wicomico, because I just talked to a guy in Somerset and he said they don't have half the problems they have in Wicomico. So apparently whatever they did back then that Wicomico got in trouble, that stigma, that burden is still there. And that's probably why we're down to 1.5 people. The people, when it happened, the people said, well, we're not going to stick in Wicomico to put up with that, and they left. So we need to find out what the problem is, why we can't get septics approved in Wicomico the same way we can in Somerset and Worcester. And like Joe said, that it's saying some people in these counties don't have to be certified, but do they have to be in Wicomico, and it's why.
So I think, Ernie, I mean, you're 100% correct, and that's why not too long ago we had Secretary Grumbles here to find out exactly what the state of Maryland was going to do, and I don't think we've seen anything adjusted since then. So
But he's gone now.
I know, I understand that,
Yeah.
and we could have the new secretary come down, though we have to wonder what impact it's going to have with someone who is only going to be there for 6 months guaranteed.
But if they don't want to do the problem, it seems like no offense, but we had to get the governor and say, look, this is
I agree.
choking our county, and if you guys don't help us out, Bill showed that Sussex County did 22 homes compared to 200. I mean, you're killing us, and if you guys can't help us out, you're going to stranglehold Wicomico, period.
We got, what, 7 delegates? How many
Yeah,
delegates?
seven.
7 delegates?
And 2
delegates
senators.
representing Wicomico County?
That's their
I'm
job.
sorry, folks, but you guys need to do something.
Yeah.
I'm sorry.
I mean, they're up there with these people every day. That's what they should be doing. They should have been fighting this way back. It shouldn't be, it's our fight, but that's what they're up in Annapolis for. They should be doing this for us.
Well, we'll reach out to the new secretary to try to see if he wants to come down and talk to Wicomico County. It won't hurt, at least, if worst case scenario, you could pass it on to the next administration. Yes, Josh.
Just brief, I'll just say, of course, the delegates and senators, they have, they haven't had budget responsibilities in the same degree that they will this coming year. Obviously, that's been stuck in the hands of the governor, and this has been a long-standing issue. I mean, but from estimates that I've seen so far, between 21 and 32% of the Department of Agriculture, Department of Natural Resources, and Environment, all of these are underfunded dramatically. I mean, by almost a quarter for most of these. So this is part of that issue. If this were only a Wicomico issue, we could have that taken care of like that, but it is not. Unfortunately, the state of Maryland is having this is affecting us. So this is a crisis as far as I'm concerned. And this is not a new crisis. This is an ongoing. So we need to do something dramatically. I don't know whether mixing the two, the ARPA funds or other kind of things, mixing that in. I don't know if that's a good or bad, but one way or another, this is a freaking crisis, and it has to be addressed. We have to do something about it. And if that's what we have to do is give them extra money, then so be it.
All right, let's get down. Just do a consensus on the 57.5. Is it?
John, can I ask one
Yes.
question? So, Pam, I just want to make sure. So, with the ARPA funds, if we just allocated this to the Department of Health to address environmental issues, would that qualify under the ARPA funds? Okay.
I don't know that answer. And the other thing you have to understand is the 57.5 does not include FICA. If we take them on as employees, well, we have to do workers' comp. So it's not just 57.5. I've got to add on at least FICA, possibly workers' comp, because if we have to take them on as employees, they're going to count on our employee count to workers' comp.
And I know in other counties what they do is they just allocate that funding to the health department
But the
under
health depart-
environmental.
Yeah, but the health department doesn't have the ability to pay these people. If I'm understanding the concept correctly, you want additional salaries to go to these people. The only way to get additional salaries to go to these people is if we, as the county, pay them, because the state is not going to care that we're sending an additional $57,500 to the health department. They're certainly not, they've already told us, they're not raising the pay. The only way these people are getting pay is if the check is cut by us to the individual, not to the state.
So it would be almost like adding a new position
Yes.
and continuing to fund that position. So is that what we need to look at, adding a new position to the county?
Well, but the problem is it's not a position. It's a portion of a position, which is not something that we do really. And it's, again, it is a rabbit hole that I don't know how to deal with.
There are all
honestly.
kinds of unintended
You shouldn't,
consequences.
you shouldn't have to deal with it. I think it's an administrative and it's an HR responsibility.
It's a payroll.
I understand that
And payroll
eventually.
falls under finance.
And I get that, 100%. But HR and the administration ought to know from your help how much the money is, what the FICA might be, and whatever other benefits may entail, and what that total number will be, and then they need to work from there. I think you're putting too much on yourself, my personal opinion.
But ultimately, the budget falls under finance, payroll falls under finance. So additionally, if we're paying these, then we have to amend the position control.
Well, we could put in 72,000 instead of 57.5, and that maybe could give you a rough bump to allow for that. Or there can be future amendments. We're just trying to create an impetus to get this started, to make people start making something happen. And we're trying to say, we're going to give you the funding if you can make it happen. So if it has to be 72 instead of 57 to possibly cover all the other benefits, we'll do it. And if that's too much or not enough, we'll worry about that in the future. We're just trying to get a number today.
But what I'm trying to get to is what is the amendment that I'm going to help craft? And I don't know the answer to that question. Because the amendment, if they're employees, then we do have to add them to position control. We have to say how much dollars. We have to, because of these other things that we have added as a process for us, those are all things that we have to consider.
Not to throw a kink in the wheel here, but will the health department even recognize this person if we give them the money to, I mean, will the state allow them to do it? Do we know that? Do we have an answer to that? I mean, look, I'm trying to be devil's advocate. I mean, I'm willing to do whatever we can do to get the ball rolling here, but will the state recognize this person's ability to do the job?
Well, and you're not looking at adding a new person. You're looking to supplement the pay for the positions that they already have approved, is what my understanding is. So
Okay.
if they have a approved position for $50,000, we're going to give them $5,000 more.
Oh, okay, I understand. Excuse me, I was confused. So they're going to get two paychecks?
Yes.
Okay.
So-
Sorry about that.
Or-
I thought we were trying to commit it.
And I'm just asking that from
So
my standpoint, I reject the premise of the argument. I don't believe that necessarily giving increases in salary to the inspector or inspectors 1 or 11 is going to solve the issue, because we need to define exactly what the issue is. Me rejecting the premise is that building has come to a standstill or a stop, or no one wants to build here because of septic issues. I reject that.
I think I agree with Mr. Pasoda. I'm having a hard time understanding what an increase in a state employee's salary is going to do for Wicomico County in getting these inspections done.
Yeah, I just go back to what I said earlier. I mean, I just like to see us just, from the budget standpoint, leave this alone, obviously not leave the issue alone. You know, the issues very much needs to be discussed, and that there may be even a better way to do this, and that's all in process. I just don't see the need to address this in the budget. I mean, the issue is front and center where it needs to be, and plus I say you can come back to us in a few months and say here's the plan we got, or something that we think will help. As part of all the discussions that are going to be taking place here around implementation of sewer.
We're only going by what the health officer is telling us could be a potential solution, and it is a problem. I don't know how you can say it isn't. If you haven't talked to installers, you haven't talked to developers, and you haven't talked to realtors,
Our citizens that's trying to build a house.
you don't think we have a problem in Wicomico County, because we do, and we have had a problem, and someone has
denying
to
that.
take the initiative. Someone has to take that initiative. Larry, you're asking about the numbers, the amount of why we want to do 57. Simply because the health officer of Wicomico County says 57.5 is the number that would be necessary to give increases to 11 and a half positions. So that's why we picked that number. Pam makes a really good point. And I would be willing to say, okay, instead of 57.5, let's just go to 75,000, period. The idea is to say, here's the money, so that somebody can come back and say, what are you doing with it? What are we doing with this money? And then at least if you implement the program, you can say, we already have the money in place to get this started.
How long will the taxpayers be on the hook for this?
It is,
I don't know.
This is a ongoing, long time?
I mean, ultimately,
Commitment.
if you start paying somebody a number, are they going to want to go back to a lower number in the future?
No. And somebody's going to have to pay that.
It's a
And-
salary increase just like any other position.
But they're not our position.
You can't increase somebody's salary for the state.
So can we,
They're telling you that. It's because they're a state employee.
There's
I understand,
pension
it's a
implications.
supplemental increase, and I get that. And if we have to do a supplemental increase and maintain this $70,000, which as a percentage of the budget is a very minimal amount of money, but if this gets Wicomico County where it needs to be, where it's been suffering for the last 15 years, we need the solution.
can we add this to the pay and classification plan and just bring them on as a county employee?
I think that would be I think that would be a huge nightmare. That'd be a complete reorganization,
And growing government, absolutely.
and it would probably be in the next fiscal year, yes. I think we should.
So that's almost going back to like the plumbing inspector tied to
Yeah, I
the
think
health
we should
department.
But I think, honestly, I think we should strongly consider next year possibly looking to bring the health department, at least the environmental specialists, into the county as a department, similar to what Worcester County's doing. But that's a whole nother.
And what is Ms. Brewster's, I mean, what is she on this proposal? I don't know if anyone's talked to her or not, but on the grant program, I know you said there's people who've called the county executive's office needing assistance. So
Going back to the grant program?
no, it's all in one line. So we're not going back to it. We're discussing the same line. So with the grant program and moving it to the 57,000 for an employee, if you let me finish, that what's the biggest demand, right? What do we need? So I think that's a question for the health officer.
I think that's an outstanding idea, to bring Ms. Brewster back here to answer from A to Z. I listened to what she said, and I have in-depth conversations with Ms. Brewster. I have in-depth conversations with developers. I'm not denying that there's not an issue on some cases, and that there are systemic issues with Wicomico County in regards to MDE and Department of Health and the environmental health side. Absolutely, not saying that at all. But I also reject that where you say someone needs to take the initiative. The initiative has been taken since I've been here. We got the water sewer master plan. Again, I know that there are a myriad of issues on the permitting section, absolutely. But that's an outstanding job, is to have Ms. Brewster here and go again through why there are issues with permitting and septics here in Wicomico County. Absolutely good idea.
And I don't think we've discussed the grant with Ms. Brewster, but if you have.
I think I would like to see Ms. Brewster here too. And you mentioned Mr. Cannon bringing the secretary down if he would. Would that meeting be just for the county council, or would it be a night meeting like we've had before with the developers and people with a vested interest?
You know, Ms. Brewster was here, and she basically said she didn't have the funds to hire the people. It was a simple.
Black and white.
Still a lot of unanswered questions.
I mean, then the state wouldn't give her the funds. I don't, and then somebody, I don't know who it was, made the comment that it was revenue neutral because the permitting paid for the employees. So I don't understand, what the holdup is there as far as hiring somebody, other than maybe it's the salary scale. It could be that, maybe, but I don't know. But
This is the council that voted to support Senate Bill 113 because we wanted to see increases. It was unanimous.
Yeah,
So I don't know why we're saying there's some complication.
Through the
Kicked
state.
it out and said they couldn't do it.
I get it, but I don't understand why we're now saying we don't recognize why an increase isn't needed. We already voted unanimously to ask for increases.
But the problem is, we can't do it, so we need to bring some people in here to show us how and if we can do it. If I just keep putting money out there for nothing, we're doing nothing. We need to get people in here to say, this is what you need to do so you can take your money to these employees can get it. But let's just say, here's the money, and you guys come up with the plan. We're doing nothing.
We're not spending the money.
No, but you're
We're
still putting
approving the
you're approving
funds.
it. We can still approve it. The money's gonna be there, but we need to get the plan together so we can give them the money if we can do it.
This is putting a Band-Aid on a very large injury.
First thing we need to do is change the name of the Wicomico County Health Department to the State Health Department.
Maryland.
I mean, I think at this point where we're at, increasing the salary is our best option for the most immediate.
I don't see that.
Mr. President?
Yes.
Can I make a suggestion that perhaps instead of transferring the money or making the recommendation to transfer the money into the Health Department, that the money would go into contingency, so that way this would allow them time to work out some of those unintended consequences? Maybe talk to Howard County to learn a little bit more.
I don't believe it is the appropriate thing to do to cut the number for the grant program and try to earmark it for this, because I can't say today that we can spend it out of American Rescue. If you want to say there's money in contingency available and we adjust from contingency in the future, that's fine, but cutting the grant program to fund this, I'm not sure I'm going to legally be allowed to do this from American Rescue. I don't have that answer for you
And
today.
to Ms. Hurley's point, but if we just leave it like it is in the budget, like, as I'll say it again, you can still come back to us, 6 months from now and say,
Got a plan.
we've had these conversations, we think we can now use this funding, we can move this money, and ask for our approval to do that. Also, we got to keep in mind, all we're doing is cutting 57.5.
You can only.
That's all we've done. All we're doing, that means we've cut that from this, they don't have to put it they don't have to put it toward this pay raise, because we can't tell them to do that.
Shirley?
So in the day, all we're doing is cutting 57.5.
It's not very easy to transfer money between departments.
I know that,
Yeah, you
but it happens all the time.
It happens from contingency.
Right.
We
You
can transfer
can't,
some of the contingency and then.
You could, it's much easier to take the money out of contingency and then give it to the health department later in the year, because going between departments, you can only do that during the fourth quarter.
Okay.
We'll take it out of
That makes
contingency.
sense.
We're up to take it out.
I don't feel that we can cut this and earmark it for this.
Okay, yeah, it makes good sense. So, and it really is only a symbolic gesture more than anything, because the money's in contingency.
There's
So we could
over $1
make it-
million in contingency.
Yeah, so
at this moment.
we could take the 57.5 from contingency at any particular period of time in the next year, just through an amendment
Correct.
that the council might want to make in the budget. But again, I say it's a symbolically, I think, and to try to really, again, to create an impetus, I would like to say that we're going to transfer the 57.5, or we can make it 70,000 if you're worried about FICA, et cetera, from contingency to the health department. Whatever fund or whatever line item that is.
You could say that you would like to cut contingency by $70,000, and you're requesting that a contingency be created in the health department.
I think that is we have to send a signal to the public that we're
Doing something.
it's not just business as usual, and we'll get back to you later. That we are going to make a commitment, a financial commitment, and I think that makes people work a little bit harder on the end game.
So what if this fund runs out of money now?
Which one?
The
The 500,000.
The three.
No, we're talking about the contingency bill. We're talking
Now,
about,
I'm talking about, Fund 06, the Community Promotions Fund.
let's do one at a time.
So if
Well, that's
that,
where we're cutting
well,
from.
but if that one
No, we're
runs
not.
out,
We're
we have,
suggesting it
we
comes from
currently have
contingency.
the ability to ask for more money because there is still available in American Rescue.
Maybe I lost what you're,
Yeah, I
maybe I missed your
probably-
point.
I
So
wouldn't-
you're saying leave this, just leave this alone?
Yes.
Yeah, the initial thought
If we
was to
want
take
the
it from
money, we
here.
take it out of contingency.
Yeah,
Yes.
we would
I'm
make,
fine with that.
we would make a recommendation that, to the administration, to take the, and I'm going to say 70,000 from contingency to the health department, however you have to earmark it, Ms. Owen. I think that would be a better move, and then we don't have to worry about ARPA funds.
But
or
I
anything
think,
like that.
I think they need to come back. I mean, this is something,
Well, but by putting it in a
Work.
contingency in health department then allows us with discussion with council then as to how it would be implemented. It wouldn't have to be approved well, yes, it would if we're bringing them on as employees, because we would have to amend the pay and classification plan. But this would allow us to have the money in the department, not specified for anything other than leave it in the department, and we would come back, we could come back with potentially how to implement it.
So, I appreciate your suggestions and comments as far as the ARPA, because you're right, that would be a convoluted mess. So I think we have something on the table now of a 70,000 number to go from contingency to health department. So, Larry, yes or no?
I don't think it's a good idea.
Joe?
I'm still not sure what are we doing?
We're trying, we're recommending to the county executive, we're making a request to the county executive to transfer 70,000 from contingency to be earmarked towards the health department specialist supplemental pay.
It would be creating a contingency line in the health department for the time being.
Yeah.
All right, well, it's in contingency. They can't, nothing happen to it until we make a decision. Yeah, I'm fine.
Yeah,
And it would
I
be
guess-
earmarked for the health department.
Well, wait, I'm still totally confused. We're just saying we're going to give you 70,000. We don't want you to actually have a plan.
Well, and that's why it would
Well,
be,
They do have a plan,
but
but
that's why I'm
Well,
saying,
that's not what you said.
no,
No, that's exactly.
it would be a
problem I have, Bill.
contingency in health department. So as there's the main contingency number that's in Department 46, but county council has a line item that's contingency. We can make a line item in the health department for $70,000 for contingency. It doesn't spell out, it would not go to their normal funding mechanisms. We would not be able to do anything with it until we would come back to council, because if we are going to bring them on as employees, we would have to do stuff associated with the position control.
Well, you said the key thing there, right? It's got to come back to council.
It's got to come back to
That's
council
what
to
I'm saying.
however you would spend it out of that contingency line item, because we do not have the ability to spend out of that to employees that don't exist currently.
Well, yeah, right, that's kind of where I was going with that. So, well, all that said, then we're not touching this recommendation. We're not cutting 57.5.
No, that would not be the recommendation. The
Right.
recommendation would be you would cut contingency by 70 and move it to a health department contingency.
Yeah, it's sort of a symbolic gesture to say we really want to get off the dime.
No, I don't want symbolic gestures. I want things that are going to get done.
I
Well,
don't see this.
well, what else can we do? All we can do is fund. It's going to be up to the administration to effect the legislation for us, unless we can come up with a solution ourselves, but that's not really our purview. Okay, everybody understood now? Ernie?
Yes.
Yes. Nicole?
Absolutely.
Josh?
Yeah.
Bill?
Yes.
And chair votes yes, so we have 1 no and 6 yeses. And that is a recommendation. All right.
I have-
Have a lot of energy.
Can we go back to the reduction of the funding for the salaries? We didn't talk about if you wanted to make a recommendation of where to add that funding, or if you just wanted to go into the undesignated fund balance.
I'm sorry, you lost me.
So the $20,000 cap
Yes.
that you guys decided to do, so that's a salary reduction. Do you want that money to go to a specific department or fund, or
Can it
do
go
you
to
just want it to go? contingency, or do you want it just to go
Throw it there.
into the undesignated fund balance?
Contingency okay with everybody?
Contingency.
And it's just a recommendation, of course, they get to
Contingency is okay
decide.
with everybody?
Sesame Street.
To contingency. Thank you, Mr. Early.
You want the money to go into contingency?
Yes.
Okay.
So what do you do? Put a note with it that 71,000 or whatever our figure is earmarked for the health department?
That's
Well,
the
it-
health
it would-
department, but Ms. Hurley was talking about the differences in the money on the 20,000 cap.
Okay.
That would go to contingency.
I
Okay.
see what you're saying now.
Is there, I'm sorry, is there anything else on the list? Because I need to take a momentary break.
Take a break.
Emergency.
We'll wait for you.
Okay,
Thank
I'll be
you
right
so
back.
much. Thank you so much, Ms. Olin.
Let's all take a break, stretch our legs, man.
Take a 5-minute recess from the dinner.
No, I think we need to give her a pay raise.
Getting back from recess on the county council work session for May 24th, 2022. Any other questions from council members on anything budget related? Okay. The only question I had was, I wanted a clarification again. I'm sorry if you may have made a comment in reference to it earlier and it got by me. Exactly what is the $325,000 funding and the $500,000 funding? What is the difference between the two?
One is to move forward with permitting as allowed by the state of Maryland for potential septic or potential sewer systems in the county. So we've put money in there as we, try to start implementing that water and sewer plan. The $500,000 is the grant program to allow us to help people in the event that they have a failure and that there are no other funding options that they could get.
So
Go ahead, John, I'm sorry.
I'll make it quick. So the 325 is to implement the water and sewer plan?
The easiest way to look at the 325 is, as we continue to implement the plan and move it forward and continue the momentum that we have, we don't necessarily know exactly what is going to be coming at us as far as whether we're going to be hiring another person. We do know that we're going to need further consulting work by GMB. We don't know whether we're going to be needing consulting work in obtaining permitting to move forward. So it's an account set up in order to continue moving the water and implementation plan forward. And the 325, what was the number?
325.
325. That was based upon recommendation from our engineers to what we'd be looking at for the next year. On the 500,000, just for clarification on it, so that is if you can look at it like the MS4 permitting, where we have an account that will be accessible to us should someone need something along the lines of environmental health services such as septic use. So.
And we would be available, but we would create parameters as to how that has to be spent, and council would see those parameters before we would spend anything out of it.
See it or have to approve it?
I think it would end up having to be approved because it would be a policy, a way we would be sending money outside the county. So I would think it would need to come before council for approval.
Okay, then is that for residential or commercial? And have you had hold on a minute. Have you had that request made by the health department that there's a need for that money?
We have not had a request made from the health department that there is a need for this separate account. This is an initiative out of the county executive's office as seeing in the future, should we have again a sector of the county that's having on-site disposal system failures, or something that has to do, could be new construction, could be existing construction, could be homeowners. It might not necessarily be a specific policy, but we would come to you and say, hey, we want to utilize X amount out of this fund.
So you're saying you might use some of this money to put towards somebody's new construction? I mean, is that the business we're getting in? I thought this was to help people that were in dire straits.
It is. What I was trying to get across was the fact that we're setting up this account in order to relieve on-site disposal system failures. That is, thank you for that clarification and the opportunity to clarify that, yes.
But you said it could be for that.
Yeah, I misspoke. I apologize.
I think I understand and I empathize 100% with people who are having failing septic systems. That's why we want to get the systems working better and try to see what relief we can, or what relief we can get to these individuals based on government regulations and requirements. In other words, to try to make that we don't have to put mound systems in every time somebody wants has a problem with a septic, that they don't have to go to holding tanks every time they have a problem with their failing septic systems. I don't know if it's the government's responsibility or our responsibility as a county to pay for those systems. Our responsibility is to try to make it as affordable as possible and to eliminate the regulations that make it as expensive as it is. Not to say that someone over here is going to get $30,000 for their septic system because they really need it, while you have 30 other people over here who also need it. I don't know if I want to get into that type of process.
The state program is the current cost share is oversubscribed. There are far too many people that are in this situation, and many of them are just saying, "Oh, it's not," essentially pretending it's not happening. But without a doubt, the amount of money that is currently available from the state cost share is not enough to meet demand.
So we're
Wicomico, though?
Yeah.
I mean, I guess, is that an issue?
Wicomico is one of the worst.
so we're stepping
spent all
up
of
to
our-
supplement a state program is what we're doing here.
We're supplementing we would be then it shouldn't be with the question of whether it should be a state program in the first place. These are the individual homeowners, individual businesses who choose to go, or pardon me, individual homeowners who choose to be in these spaces to go to put these systems in. Now, the regulations have changed on them through the state that they have to go to enhanced nutrient removal, essentially a step up. But the challenge is that most all of these systems, because we all put that growth in the late 80s and early 90s, they have a 30-year lifespan. They are all now failing. So we've got a giant wave of failing septic systems, and we're not the only ones across state. So the amount that the state has for the cost share is oversubscribed.
Well, back in '07, I think it was, we had a drought. Okay, so when you have a drought, you don't have many failing septic systems, but you have another problem. You have failing wells, and the state had to step in and fund a lot of folks having to get new wells. But I think it really concerns me when you're talking $500,000 and it arbitrarily, however this money's spent. I think we need to make sure we got enough controls on it.
Well, as Pam said, yeah, I mean, they gotta create these parameters and bring them before us.
We have to create the parameters, we have to bring them before you. We have to make sure the parameters meet, because the money is American Rescue funding, we have to make sure it meets those requirements as well, so,
Can we get those before we pass the budget?
no. But we can't, I mean, it wouldn't be something that we would spend without parameters to spend it.
So you could create it, we could move this into contingency.
No.
You could create it, or you could keep it in American Rescue. You could create the policy and the parameters.
Yes.
We could approve that, and
And
then.
then we could start funding.
Okay.
It would not,
Or we could approve the funding in the budget.
yes.
Okay.
Go ahead, Jim.
And the basic parameters would be, as Councilman Hastings was saying, similar or not too dissimilar from what the Health Department has as a supplement to their program. You had mentioned the holding tank pumping, et cetera. So if they ran out of funding, there would be a supplemental account to assist in that.
What funding is that?
Say again?
What funding is that?
That's a bay restoration fee.
So, and I don't know the genesis of the critical areas funding or any of that to a certain degree. I don't know whether the state did that sort of as a compromise because, they decided to initiate policies that then, sort of compromised people's land values, and someone who is all of a sudden now in a critical area. Well, what happens if our septic goes up because now the state says, if you're in 100 yards or whatever, you can only do this, you can only do that. So I think that's what the critical areas funding was for, to help offset the added regulations that they imposed upon these homes. This is a little different where we're just saying, hey, if you got a failing septic system, we're going to help pay for it.
We're saying that we're putting funding in here so that we can create a product and a parameter as to how we would spend it. We would not just, somebody walk in the door on July 1st saying, hey, I've got a failing septic system, great, I'll sign a check and help you. No, there's going to be
Matching the component or.
there's going to be a policy that we have to create, and we have to bring that policy before council. But again, creating the policy before we had the funding and before we had the initiative that we're interested in funding this, it doesn't make sense to spend administrative time, legal time, council time if you aren't interested in us having this fund. So we have suggested a fund, and we will come back to council with parameters as to how that fund would be spent if this money stays in the budget.
Ms. Ackley.
Have you, there's also a program that DSS has where those in financial hardship can apply to have septic and well replacements. Was that, I don't know if that's money's exhausted or?
Yeah, I don't know, but that's an example of again, like a stopgap. If some of those fundings run out from those agencies, then there is someone or some place that the citizen can turn to, because it is becoming expensive, and there are a lot of failing on-site disposal systems that are requiring holding tanks or being pumped out, et cetera. So that's the motivation behind this. An initiative out of the county executive's office in order to help mitigate this issue.
Exactly, was that social services?
Yes.
I got you.
Terms of services.
I got you. Yeah, my concern, I just feel like, our position as a government body is to, do the funding to pay for services for the citizens of the county, to pay for services for the citizens of the county, not to get into subsidizing citizens in the county. I just feel like we're getting a little skew. So I'm not sure what program you would come up with if you're saying $500,000 for failing septic systems. What other program you're going to come up with, except for a program that says we're going to give somebody $10,000 to help with their septic systems.
I mean,
That is the concept.
most everything else that comes to the council in the past has said, before you come to us and ask us to do something, you've had some kind of a plan about what you wanted to do. You've been in budget deliberations for how long? 3 months, 4 months? Not deliberation, you've been working on your budget. Okay, so possibly this came up 3 or 4 months ago. I just don't understand why there's not at least an outline of a plan, and there's not anything other than this is, we're going to help people out. I can't, it's hard to say.
I will also say, though, sorry.
Yeah, that's all right, that's all right.
So,
I'm not
again,
getting
this
my
is
words.
American Rescue dollars.
I understand that.
There's no ability, this can't be moved to contingency, this can't
Okay,
be moved to
understand.
top to the fund balance.
But you're asking us for approval for $500,000 and.
Without us spending a dime of it until we come back to you.
I know, but
So-
you're still asking us to approve it.
So do we, I mean, if, there's no point in wasting, like you said, administration and legal time if we have no intention of we're not entertaining this whole grant concept, right?
I mean, if you're not entertaining the whole grant concept, then the thing is that it, the only way to adjust this is to reduce revenue and reduce expense.
I don't know if there's any reluctance to approve it. And when it was put in the budget,
Joe, I'm a little reluctant to approve it because we don't know what it is.
I know,
You know,
I know. Well, that's what I'm
It makes me, I'm like, well,
I mean, I
what
don't
is
think
it?
there's any reluctance to try not to help people is what I'm saying, but we need to know what we're going to
Yeah,
do.
what we're doing
Yeah,
with it,
yeah.
yeah.
Well, I think we could figure that out at a later date. When push comes to shove, any kind of update to folks' septic systems is good for the real estate market. It's good for the Bay. It's good for the homeowners who suddenly find out when they go to sell their house, they don't have, they have to come up with $30,000 or they're going to lose that out of the value of their home. So in general, I think it's a program where we could put some very strict parameters on there, but at least we have a step towards helping folks in Wicomico County. And that's going to be very good for the real estate market, which, as we've all noted, is challenging enough in Wicomico.
Would you like for the council to put the parameters in by next budget?
Let's leave that an administrative
we could.
function.
To President Cannon's point on the previous topic regarding the salaries to the environmental health, this is a signal to the community that we're trying to address an issue.
I think the environmental health specialist funding was to enhance our services. I have a problem with the county picking winners and losers and deciding what subsidies we're going to pay. I don't mind paying for extra services, but I have a problem with us getting into the game of subsidies. Unless it's emergencies like we know was the case with COVID.
And
emergencies.
there are times that our citizens may need to be subsidized, but I still would like to see a plan because we're asking for money to throw out there, and by the time this is approved, a couple months later, there will be a new council here, so we're making decisions for the next council. It's
But this would be
a lot to
using
think about.
federal dollars, right?
Still tax.
To then still be put towards our overall, the value of our homes will then rise by investment into the Wicomico County as a whole. Now, we could limit it towards, they could come up with a program that basically limits it towards age or, income restricted or other kind of ways, but without a doubt, the need out there is really great. Now, it's questionable whether or not most of these homes should have been built where they were built at those times. We can't do anything about that. All we can do is be forward-looking.
Well, we were charged with being good stewards of that program, of that monies, so that's what we're trying to be.
Right.
Yeah, if we were using this funding to start a wastewater treatment authority, and we recognize that, I'd say, yeah, heck yeah, if you realize that, that's good. That's what, we're getting somewhere here. But I just have a little bit, and I appreciate the gesture, but I just, again, I have a problem with the county getting the business of paying for septic systems for individual parties and picking winners and losers. So.
And in reality, the $25,000 a system, if we fully funded a system, would that be 20 systems we could fix out of all the bad systems in the county? That's not a lot.
And we do not know if a cluster pops up or something like that, so.
So the question on the table, there's two issues. One is the 325 that is going to be funding to allow for continued efforts with the water and sewer plan. Am I correct?
Yes.
Okay, so is everyone okay with the
Yeah,
325?
I'm all for advancing on the water and sewer plan.
Okay.
We're way behind.
The second issue through the budget, the budget message is the 500,000. Is everyone okay with the 500,000?
Can we get an outline of a
Yeah, I'd
plan?
like to see the plan first.
I
yeah.
cannot accomplish an outline of the plan by June
understand.
7th.
I understand.
I can't. So,
But should you
again,
even be the one doing that?
but I don't think any of us can get it, I don't think we can get it accomplished by June 7th. So what I'm asking is the funding staying in here? And does council want to move forward with this funding? If not, it doesn't make a whole lot of sense for us to spend time crafting something that council's not interested in.
Hey, Laura, is it secure if we put it in there and without a plan?
Funding would be available. What she's saying is that she would have to come back to council for the plan.
Is that part of the game? We have to
It's the
approve it.
same with the fire department. The funding's there, and then you got to come back to council for the plan, development of the
All right.
plan.
But the
I
fire
would
department's
expect
been
them to
there
come
forever
back
and
to
a
work
day.
sessions right after the budget's approved.
Then again, the fire department is services. Those are services that we're
Yeah.
paying for.
We could just-
Been there forever and they're needed.
Okay. Larry, yes or no?
No.
Joe?
No.
Ernie?
Yes.
Nicole?
No.
Josh? Yes.
And Bill said yes before he left, and chair votes no. So we have a 4-3 on no on the
No,
500.
I honestly don't know how to accomplish what you want then, because you have to cut revenue.
Well,
Because it's not coming, I can't have you move it to another
No, I don't-
expense line.
I think we were voting on whether or not we wanted to approve the funding for this grant program.
Yeah, but I can't.
And we said, no, we didn't want to do that, so.
Correct, but that means then I have to cut revenue and expense because it's not coming from general fund revenue.
The charter says that if they cut and you guys don't agree with the recommendation of where to put the money, then it would go into the undesignated
It
fund.
can't go into undesignated, it's not our money.
Hold on.
It's
Just
federal.
stay in the ARPA fund then? I mean, it could be designated to something else that is
But
approved
I
for
can't,
ARPA. I mean,
it's kind of the same thing as.
and I don't think you should be figuring this out, Pam. Like, I get it.
But it's ultimate, it is my responsibility to figure this out. It is my responsibility to make sure we are spending our money in the way that we are allowed to spend our money.
Do you know all the needs of every department?
But what I'm saying is American Rescue has very specific, this funding is from American Rescue. It cannot go back into contingency. It can't drop to the bottom line. It is not our money to drop to the bottom line.
Could we add it to the 350 to get water and sewer?
You can add it to
Before
that.
we get there, isn't there, but there is, this isn't the only ARPA funding that we have in the budget. We have the massive amount of millions of dollars.
We
that-
have it in there for salaries, very specific things that council's approving with this budget. There,
The majority of ARPA hasn't even been designated for anything yet.
Yes,
I know.
can you show it as a grant? ARPA grant?
but if you don't have an expense for it, I can't recognize it as revenue.
Can't you put it back where it came from? I mean, we have millions in ARPA funding
But
right
what I'm
now
saying is
as a
I'm-
reserve,
I'm
right? Let me
recogni-
finish.
Okay.
Don't we have millions of dollars right now from ARPA funding in reserves?
No, it is not in our reserves. It is in an unearned revenue.
So why can't we put this back into the unearned revenue?
The only way to put it back into unearned revenue is to cut revenue in the budget.
Which council cannot do.
So we could allocate this
So why are
then.
you asking our permission to even approve it? Because it sounds like it's whatever you've created is already.
But what I'm saying is that if you leave it there, if council has no desire to do anything with, there's two things that you can do with it. You can either tell me you want to transfer it to where the 325 is, or tell me we're not interested in this program and we don't spend it. And we don't come to council with any kind of legislation as to how to spend it. It just wouldn't be spent.
Then you're
Right.
losing money. I mean, you're losing that
No,
ARPA
because what
money.
happens is that ultimately, because I didn't recognize it and didn't recognize it as revenue because I didn't put it in for, I can then reallocate it again next year for ARPA projects. But I can't, if council has no desire for this program, the cleanest and easiest way is just leave it in there, leave the revenue, leave the expense, and we won't come before you with any kind of product.
So where would this 500 be?
It would stay in American Rescue revenue, and it would stay in $500,000 worth of expense that we'll never spend.
This year. But
This
she's
year.
saying in future years, she could spend it.
Whatever you have to do, I mean, I think it's very clear what the council as a body
But what
wants to do.
I'm saying is that you will not see this as a budget amendment, because I can't amend it.
We're all grown-ups here. I think we've asked you to consider what we have recommended, and we hope that you will honor that and follow through with it,
Okay.
right? And I think we can all live with that, right?
We are adults, yes, I believe.
If you're telling us there's nowhere else
I mean,
to
the
put it.
only other, you can't put it somewhere else. The only other thing is that we as the administration, if council has no desire for this, we as the administration can recommend a $500,000 revenue cut.
So
And
every
I have
time
to
you-
talk to John about
So
it.
every time you make a recommendation to this council for ARPA funding for anything, and this council maybe rejects it, we have a problem?
Well, but in the budget process, yes.
It's in the budget, though.
In the
get it.
budget process.
I get it.
If I come to you for supplementary ARPA funding and you say, no, we're not interested, it doesn't move. But in this budget process, you don't have the ability to amend revenue. You have the ability to amend revenue in separate legislation. Just in this legislation, you do not.
We're just asking you to consider not doing it, not putting it there in your budget at all.
Spend it.
Is the difference from last year, or this current year, fiscal year '22 budget ARPA funding, the difference is it was shown as a grant as opposed to an expense? Is that why?
Now, we had them in there as revenue, and you guys just didn't cut any of the products that we put in, but we ultimately didn't spend it on things because we got additional information. And so that money is still available to us to reappropriate in future years.
I'm thinking of like the salary increases that you want to use ARPA funding for. So that wasn't actually allocated, though.
It's in there as revenue, and then we have expenses that we're going to then show when we do our reporting to the federal government, we're going to show how we spent it.
All right. Couldn't do your job. Could never do your job. Any other questions? Budget questions? Anything? No? Any other questions, comments? All right.
Thank you for your hard work.
Entertain a motion to adjourn. Moved. Second.
Second.